Good morning. I'm absolutely thrilled to be here this morning. We came down with about 15 scientists to Houston, Texas about 5.5 years ago to start this very unique entity called the National School of Tropical Medicine, which would be based at Baylor College of Medicine and the Texas Medical Center, the idea being that this would be the first school exclusively devoted to poverty-related diseases. And we moved in August of 2011. How many of you were in Houston in August of 2011? You remember it was the hottest summer on record, so I moved at the perfect time. It was okay. My wife was really good about it. We moved from Washington, D.C. She didn't say anything. It was 100 degrees every day in August, and she didn't say anything for the first 3 weeks, and finally she said, you know, it's really hot here. that was the only complaint. But it was in that terrible August or September right afterwards that Dr. Osteen and his family came to see me. And he showed up at my door one day and said, how can you help? How can we help? And to which I answered, you know, Dr. Osteen, I've devoted my life to this interesting group of diseases called neglected tropical diseases. These are the most common afflictions of people who live in poverty. And they certainly are neglected. They're diseases such as elephantiasis and schistosomaisis, and I'll tell you about them in a moment. And I guess if I were to ask for your help, Dr. Osteen, I would say help me take the word neglected out of tropical diseases, take the N out of NTDs. And so as I'm standing here before you, looking at the sea of people in this incredible sanctuary of the Lakewood Church, suddenly the light bulb went off, or maybe someone's talking to me, and I suddenly realized, Dr. Osteen, you're delivered. You took the N out of NTDs. Thank you. Thank you. This is an incredible opportunity. So what I want to do is kind of give you a brief overview, a 30,000-foot overview of these very important, very interesting diseases. And it's a good news, bad news story. We've made great progress in some ways over the last few years, but we're falling behind terribly in others, and to kind of give you that big perspective. And I'm going to use this as the framework. You heard from Dr. Dyer about advocacy. These two documents are kind of our guide for advocacy for diseases of poverty. One is called the Millennium Development Goals on the left, the other is the Sustainable Development Goals on the right, and they provide the framework by which global leaders really try to lift the bottom billion, the poorest people in the world, out of poverty. And these are important documents because between 2000 and 2015, as you heard from Dr. Dyer, this is what launched PEPFAR, the President's Emergency Plan for AIDS Relief, or what launched the President's Malaria Initiative. So much of this came out of the initial leadership of George W. Bush, and then it was expanded in the Obama administration. And there was a particular focus for infectious diseases. And if you look at that box labeled number 6 on the left, it was called To Combat AIDS, Malaria, and Other Diseases. And we're part of this big initiative called the Global Burden of Disease Study, which is based at the University of Washington, Seattle. And I'm a small part of it devoted to actually looking at the progress of those Millennium Development Goals on infectious diseases, including neglected tropical diseases. And the numbers so far are looking pretty good, which is that we've saved 19 million people from a death from HIV/AIDS, 30% reduction in malaria. So the Millennium Development Goals really have had an impact because it's persuaded the US Congress to appropriate funds, to treat people for HIV/AIDS, to treat people for malaria, to provide bed nets. That's the part of the good news part of the story, but there was a problem with that Millennium Development Goal, and it was called To Combat AIDS, Malaria, and Other Diseases. Now for AIDS and malaria, what did we do? We mobilized Bono. You heard about Bono. We mobilized George Clooney to talk about malaria. Brad Pitt did a 4-part series on AIDS and malaria. And back then, if you got Brad, you also got, yeah, and she also got involved. Maybe I hear they're getting back together again. Maybe they're going to do more for AIDS and malaria. But there was a problem, and the problem was there was the third component. What was the third component called? Other diseases. You didn't see Brangelina standing up there saying, other diseases, right? So what happened was those of us who worked on other diseases realized we were on the outside looking in of incredible global forces that were happening, treating AIDS and malaria, but nobody cared about our diseases. So a group of us, a group of 3 or 4 of us, including 2 colleagues from the UK, got together and we did a branding exercise. We said we're not going to get anywhere calling them other diseases, so we grouped this group of diseases, other diseases, and called them neglected tropical diseases. In retrospect, it wasn't a great name, but now people are starting to catch on, so we don't want to mess with it. So we call them NTDs, and at that time, there were 13 or 14 tropical infections that we identified as highly prevalent among the poor, ubiquitous in poor countries of the world, and one of the interesting things about them, they're chronic and disabling conditions, and I'm going to go through the list for you in a minute. Another really interesting component of these is most of them are ancient afflictions. You can find, of these 13 or 14 diseases, you can find very accurate descriptions of these diseases in the Bible, both in the Old Testament and even in the New Testament. So it's really very impressive how there are deep descriptions of these. God was an incredible neglected tropical disease scientist. He really accurately described them. And very important about these diseases, they both occur in the setting of poverty, but they cause poverty. They cause poverty because they make people too sick to go to work. They shave IQ points off of children so they don't grow to their full potential. They particularly strike girls and women. And so the problem at the time was that we didn't have a Bono or an Angelina to kind of help us make people aware of these. So we've decided as a group that we're going to take on these diseases myself. And I wrote this popular book about the neglected tropical diseases, which my kids forever called Dad's Forgotten Book on Forgotten People with Forgotten Diseases. But now it's gone into its 2nd edition, which really describes these conditions, even got translated into Japanese. So what are these diseases? So here's the list. I like to call them the most important diseases you've never heard of, because every single person who lives in extreme poverty has at least one of these diseases. So we have 760 million people afflicted with ascariasis. What's ascariasis? Intestinal roundworm infection. A lot of these are wormy diseases. Or 460 million people with whipworm infection, or hookworm, or schistosomaisis, or dengue, or foodborne trematode infections. Lymphatic filariasis, otherwise known as elephantiasis, 38 million people. River blindness, 15 million people. Chagas disease, leishmaniasis, trachoma, and the list goes on. Now we've added Zika and Ebola. But the key is every person who's poor is affected by this disease. And I'm going to give you an example. So this is one called lymphatic filariasis, elephantiasis. Anybody remember how many people have it? It's a quiz from the last slide. 38 million people have it. This is not a rare disease. These are ubiquitous in some parts. This is a disease that's ubiquitous in some parts of Indonesia, in India, and Nigeria. And one of the reasons that these diseases get neglected is people don't die from this disease. This is not a killer disease, but look at the effect. This individual says it's quite a problem for me when I have to stand at work for long periods. He's too sick to go to work, he's too sick to provide for his family, so as a result his family is trapped in poverty because of this disease. It's a parasitic infection transmitted by a mosquito. So one of the really hard parts of trying to get the neglect out of neglected diseases is getting people to care about these diseases and trying to give you a quick way of understanding these diseases. And this is a problem because it takes time to explain. This is not a 30-second UNICEF commercial. It takes time to explain. One of the ways we're looking at this is we've created a worm index, or neglected disease index, which adds up the number of people affected by a neglected disease in your nation and divided by the population. And we can show that as your worm index rises, your human development index, which is a measure of life expectancy, educational attainment, how you treat girls and women in your communities, that goes down. And we have now evidence to show cause and effect, that as your worm index goes up, your human development index goes down. And these kinds of metrics are important to appeal to the policymakers. Here's another one that we're really struggling with. It's called female genital schistosomiasis. How many people have heard of it? Almost nobody, right? This is the most common gynecologic condition in Africa. The most common affliction of girls and women in Africa. It's caused by a parasite called the schistosome that deposits its spine-shaped eggs in what we used to say was the bladder of people. That's because nobody ever bothered doing a colposcopic exam on a girl or a woman with this condition. Now we realize that half the girls and women, more than 100 million people, more than 100 million girls and women have those same lesions on their cervix, uterus, and lower genital tract. It's a cause of pain, bleeding, stigma, and now it's been linked to a fourfold increase in HIV/AIDS. This may be Africa's most important cofactor in its AIDS epidemic that nobody's ever heard of. So really trying to raise awareness is so important. And one of the reasons I'm so excited to be at a place like the Lakewood Church is when we crunch the numbers, and we've done this recently, we realize that Christian majority countries are getting hit especially hard. The Pew Foundation has done an amazing study that looks at the changing demographics of the world's Christian population. So at the turn of the 20th century, 75% of Christians lived in North America and Europe. And as of 2010, the world changed. It flipped. Now, most Christians live in the global south, in sub-Saharan Africa, in Latin America, in parts of Asia, like the Philippines and Papua New Guinea. And so when we look at the world's neglected tropical diseases, 96% of the world's Chagas disease cases are among Christians. Chagas disease is basically a Christian disease, or sleeping sickness, or half the world's cases of schistosomaisis, or leprosy, or intestinal helminth infections. And this is why it's so important to get the church involved, because these are the diseases that are keeping Christians buried in poverty. So what do we do about this? And Dr. Dyer, I loved your lecture because it really points to the power of advocacy, and you're absolutely right. It's just a matter of taking the time to do it. So at this time, I was chair of microbiology at George Washington University, and we had written these two papers on an opportunity to not only group these neglected tropical diseases, but we'd come up with a package of medicines that were being donated by the major pharmaceutical companies that we could give for 50 cents a person per year. Essentially free, because the drugs were free. It was the cost of delivery. And because these medicines have such a good safety profile, they could be delivered by a community health worker or a school teacher. You didn't have to be a trained healthcare professional. But what do? We wrote as scientists, we're taught we write the papers so we can then write a grant so we can write more papers. So we can write a grant so we can write more papers. So the idea of taking the time and actually talk to elected officials is just not something in our DNA. It's not something we do. So at that time I was at George Washington University, and I said, I'm in Rome at the height of the Roman Empire. And I got into a taxi and I went to the congressional office buildings in the White House, trying not to get arrested, and just started talking to people who would be willing to listen. And what happened was it really had a very powerful impact. And actually one of the reasons was I was lucky, because President Bush had just created PEPFAR, and they were looking around for another big picture global health initiative, and President Clinton had just started the Clinton Global Initiative. And that was very important. One of the things that I learned, and it's a lesson for today, is to get anything done in DC, it has to be bipartisan. If you don't have buy-in on both sides of the aisle, it's not going to happen. And this was a good time in the early 2000s. Democrats actually spoke to Republicans. Republicans actually spoke to Democrats, and you could actually get something done. I'm not sure I would have been as successful today. But here's what we did. We started with $15 million appropriated. Now, that may not seem like a lot of money, but at 50 cents a person per year, we got 30 million people treated right out of the beginning. And now, we did this through the United States Agency for International Development, and according to them, now 450 million people have received this package of medicine. So it's really, I think, going to make a very important difference in the world. And now, through the global burden of disease study that you've been hearing about this morning, we now have the numbers to see what's been the impact. And here's where we're at. We're looking at a 50% reduction in lymphatic filariasis, 52% reduction in river blindness, trachoma, ascariasis, sleeping sickness is almost eliminated. And then the Carter Center has been fighting guinea worm, and they've made huge successes. So we're at the point now where we actually can talk about eliminating these diseases as a public health problem, making them go away, actually interrupting transmission. That's the good news part of the story. The bad news part of the story is we're going the opposite direction on another very important group of neglected tropical diseases. Leishmaniasis is going up, dengue, Zika, of course, is going up, Chagas disease, Ebola is going up. So what's going on? We've had great success on the one hand, and as we're all kind of sitting around congratulating each other, all of a sudden have risen up this other group, a very important group of neglected diseases, and they tend to be two kinds. One, those that are transmitted by vectors, meaning insects or snails. So leishmaniasis, Chagas disease, dengue, Zika, but also schistosomaisis, and also zoonotic diseases transmitted by animals. So that's where we're at, where looks to me that I've been playing a game of what I call global health whack-a-mole. So we've had big impact on AIDS, TB, malaria, and some neglected tropical diseases, and now arising these new vector-borne diseases. So what's going on? What's the rise of these vector-borne diseases? And I'd like to switch gears a little bit and tell you where the world is heading now that we've got this onslaught of, you've been hearing it in the news, Zika, chikungunya, dengue. It's not a coincidence. There's something going on. And I don't have all the answers. I think this is part of the answer. How many people have heard this term, the Anthropocene? It's one we like to kick around in colleges and universities, but nobody else knows about it. And it goes something like this. If you look at the big geological epochs, when we talk about the Pliocene, the Pleistocene, then the Holocene that began at the end of the Ice Age, the idea is that humans have so profoundly altered the environment that we've now bought ourselves our own geological epoch over the last decade or so, called the Anthropocene, anthro referring to people. And we now realize that we've got some new forces in play that we didn't realize before. And I just want to quickly go through some of those new forces. We have a shifting nature of poverty, conflict, climate change, deforestation. Climate change is a hot topic right now. Al Gore was just in Atlanta talking about climate change and health. And climate change is very important, but I like to point out that climate change is just one of about 5 or 6 forces that are now driving these new vector-borne diseases. So I quickly want to go through a couple of them. First of all, there's been a changing face of poverty. And it may have to do with all of the successes that we've seen coming from these big global programs like PEPFAR, the President's Emergency Plan. We've seen a big drop in deaths, but we've lifted enormous numbers of people out of poverty in the world's poorest countries. And I've recently written a book, my second forgotten book, called Blue Marble Health, that finds something kind of counterintuitive. And what it finds is that where people live in extreme poverty and suffer from poverty-related diseases has changed. The paradigm of developing versus developed countries is giving way. We're seeing a rise in all global economies, but it's leaving behind a bottom segment of society. So it's not your father's global health, not your mother's global health. It's a new type of global health, which I've given a new name called Blue Marble Health. And this is the most provocative picture in the book. It's a new map of global health. What I'm showing you are the areas of intense poverty in G20 countries. So if you look at the 20 wealthiest economies, there are intense pockets of poverty and disease that are now accounting for most of the world's poverty-related neglected diseases, neglected tropical diseases. So look at Brazil, for instance. Northeastern Brazil, that's the home of most of the cases of schistosomaisis, leishmaniasis, dengue in the Western Hemisphere. What else is northeastern Brazil the home of? Sort of what am I thinking question. Yeah, Zika. Zika. So why did Zika rise in northeastern Brazil? That's the pocket of intense poverty in the Western Hemisphere. Or northern Argentina. Or China. If you look at China, not so much Shanghai and Beijing, but you go in southwestern China into Guizhou, Yunnan, Sichuan provinces. You go back in time 50 years, 175 million people living in extreme poverty and suffering from disease. And so those are the numbers on the right that basically say most of the helminth infections and tuberculosis and leprosy and visceral leishmaniasis and dengue and leprosy and everything else are occurring among the poor living amidst wealth, the poor living among the wealthy. And this, in some ways, is very important from an advocacy point of view because it says if we could get the G20 leaders to pay more attention to our own vulnerable populations, we can melt away most of the world's neglected diseases. So what's going on there in the United States? Do we have poor people in the United States living in the South? We have 12 million Americans living in extreme poverty, living with a neglected tropical disease. Most of them in Texas and the Gulf Coast. And when I wrote about this last year in the New York Times, why we're vulnerable to Zika, this New York Times drew for me one of the most amazing 80s Egypti maps. Wherever you have extreme poverty, you have those diseases. And this is what poor parts of Texas look like. In the colonias, even here in Houston, in the poor areas. And so these are the number of Texans living with a neglected tropical diseases. They're not rare diseases. They're incredibly common, but they're among the poor. The other big driving factor that we've been seeing next to poverty is conflict. Why did Ebola arise in Guinea, Liberia, and Sierra Leone? Not because it was tropical, but because those countries have been decimated by years of atrocities and the health system has collapsed. We're now in the same situation. You saw those incredibly moving pictures of the ISIS-occupied areas in Syria and Iraq. Well, guess what's following? We've seen this horrific rise in leishmaniasis, schistosomaisis. The locals call leishmaniasis Aleppo evil. Hundreds of thousands of little girls are getting disfigured every year by the bite of the sandfly that's causing this disease, leishmaniasis, that causes a permanent scar and then renders them unmarriageable or grounds for spousal abandonment. Animals are being trafficked. There's no more borders, so we're seeing this massive rise in brucellosis. This is going to be the next Ebola. It won't be Ebola, but this is where the next group of diseases are coming from. And then we've got this curious phenomenon. All of a sudden, in southern Europe, we've seen malaria return to Greece after it's been gone for 70 years. Schistosomaisis in the island of Corsica. Chikungunya, West Nile virus in South France, Italy, and Spain. Dengue in Portugal. What's going on? I actually wrote about this and described it to the early sequences of the 1980s Ghostbusters movie where the green blob is on the dining room table in the hotel and the skeleton in the taxi cab. And you know something really bad's about to happen, but you can't quite connect the dots. That's what's happening in southern Europe. So what's causing it? What's causing this massive rise of disease in southern Europe? Anybody want to take a guess? Someone says climate change. Well, yeah, if you talk to the climate change people, they'll tell you next to the Arctic, southern Europe's next shoe is going to fall. People are saying, well, maybe it's people fleeing the conflict coming over from the Mediterranean. Maybe that's going on. And then there's the economic downturns that have happened throughout southern Europe. And the answer is, we have no idea. Why? Because our universities are not set up to study this. You know, universities have become very siloed. And now that I'm a dean, I'm part of the problem now. I've helped create these silos, right, where the microbiologists don't talk to the economists don't talk to the political scientists, no one's talking to the climate change and geological scientists. So we've got to, what we're seeing now are these complex problems of a swath of vector-borne diseases across Texas and the Gulf Coast, across Southern Europe, in the Middle East. And we're going to have to engage in this uncomfortable dialogue between people in order to solve problems. It's also true in the different branches of government. So one of the things that we're trying to do now in our labs at Baylor and Texas Children's Hospital, and the two are linked, is we've basically moved what my kids also call my guaranteed money losing company down to the Texas Medical Center, where we're actually making the vaccines that no one else will make. Why won't they make them? Because they're for diseases of extreme poverty. So we have a hookworm and schistosomaisis vaccine in clinical trials now, new Chagas disease, river blindness vaccine, a MERS coronavirus vaccine, trying to take those on. And it's called the Sabin Vaccine Institute in Texas Children's Hospital Center for Vaccine Development, and it's named after Dr. Albert Sabin, who discovered the oral polio vaccine, who said this amazing quote, which is a scientist who's also a human being cannot rest while knowledge which might be used to reduce suffering rests on the shelf. So the idea is we continue with those package of medicines, continue to melt away a group of neglected tropical diseases, but recognize now we're going to need new technologies, new interventions in order to take on the rise of these vector-borne diseases. So I'll stop there and again thank Dr. Osteen, thank the Lakewood Church for this amazing opportunity to address you today. Thanks so much.